Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer submitted questions and addressing the latest COVID headlines through today, December 7th. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So, Dr. Murphy, I'm going to start with some updated COVID statistics.
Great. Good morning, Sophie.
In the United States, yesterday, we saw 48,405 new cases, with cases unfortunately increasing by 28%, as we'll talk further about. There's currently a 7-day average of about 54,000 positive new cases. Hospitalizations have increased by 29%. Fortunately, the death rate is decreasing by 10% in the United States. In Illinois, yesterday, Illinois saw 3,804 new cases with a 7-day average of 3,469 positive cases, with a 69% increase over the last 14 days. Hospitalization cases are increasing by 31%, and the death rate in Illinois is also decreasing by 13%. So, Dr. Murphy, we touched on this. We will touch on this further, but tell us a bit about what these statistics mean in light of this winter surge.
Well, this what's happening and over the last couple of weeks is since the Thanksgiving holidays in particular, is this big increase in respiratory infections from COVID, from flu, from RSV, respiratory syncytial virus. All three of these are occurring at the same time. Now, they're not although you can get both of them at the same time, it's usually just one outbeats the other one. And there's a whole movement now to look at all this as a pack of infections because they're seasonal. It's related to the holidays, it's related to the weather, it's related to people being indoors. And there should be a big peak and then it should go down, just like with flu every year. We used to not test for RSV, but now we test for it all the time. And so guess what? It's all over the place. So what's happening now is the predicted winter wave. So in this case, COVID is going up, hospitalizations are going up, capacity appears to be okay, but the big difference from before is the mortality rate is not going up. Now, typically mortality does lag, because people that get sick end up in the hospital. The hospitals are very good treating this now. So, that fewer people die from it. Everyone, there's treatments out there to give and whatever. But it's still, there's no big uptick in the mortality rate. Still about 300 or so cases per day in the country. That still results in, quite a few cases, 300 a day. But it's good that that's not going up. And I think that's where we are with this whole thing. In other words, cases are going to continue to go up right now for flu, RSV, and COVID. Hospitalizations are going to go up, particularly in people who have underlying diseases and the elderly. The mortality rate is going to stay fairly stable, about 3 times worse than with the flu. So it's bad, but it's stable. So that's the kind of where we are, and we'll just see how this goes through January. What will happen is it'll peak sometime in January. If it's like the flu, it'll peak sometime in January and start coming down in February and March.
Wonderful. And now going into our first COVID headline, which touches on a lot of this, is hospitalization increases are rising post Thanksgiving after an autumn low. So what can you tell us about what's going on with flu and RSV and hospitalizations with COVID in general?
Yeah, well, the hospitalization, as I mentioned, is going up, and this is a big concern. However, the capacity is still there to take care of these people. But if you've been in the emergency room lately, it's pretty crowded with people who are sick and being evaluated for admission to the hospital. And this is likely to get worse over the next 1 to 2 months. So, we'll have to be careful about that. But remember, there is treatment for flu, there is treatment for COVID. And so people that do get sick, if they're eligible for the treatment for either one of those, they should get treated, and you should get treated as quickly as possible. The treatments work better if you take it earlier after the onset of the disease.
Wonderful. And now going into our second.
And if you haven't been vaccinated yet, please get vaccinated.
Gotcha. Absolutely. And now going into our second COVID headline. A year after the Omicron surge, officials see a reduced COVID threat this winter. So what is the skepticism about this winter, regarding Thanksgiving, etc.?
So last year we had the Omicron surge, and it looks like we're not going to get that. That was an enormous spike, and we're not going to get that this year. And so, but we're getting this combo of COVID, flu, RSV, and as we said, this is what's predicted because of the seasonality, the holidays, and whatever.
Wonderful. And now going into our third headline. There is a drop in COVID alertness, which could create a deadly new variant, the WHO is saying. So what would this mean about this lapse of COVID strategy over the last couple of months?
Well, this is a predicted concern, because the more of this that we let just replicate out there, in other words, we give up on all the mitigations and we just let the numbers go up, 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 up. We know how this thing mutates. So what they're saying here is, who knows what the next variant is going to be? Well, we saw what happened with Delta last fall, and Delta was more deadly. And then, and it was off season. It started in August 2021. And then what happened? We had Omicron, and Omicron was so much more contagious. It was less deadly, but more contagious. We had that massive peak in January of last year. I mean, it was just enormous. But by then we already had treatments and whatever, and people were vaccinated. So we could handle that. But everyone has sort of backed off in worrying about the disease, uses of masks and whatever. And if we just let this thing roll without doing anything about it to kind of bring down the numbers, there's going to be another variant, and the variant could be worse. It's all these if so no one really knows what's going to happen. And this is just a warning that if we just let things get out of control, this thing is not done with us, and another variant could come. And is it going to be like Delta or Omicron or whatever? We don't know. So that's really what the concern is.
Right. And going into our last COVID headline is that myocarditis after COVID-19 vaccines are at an all-time low among teens and young adults, a large study is now finding. This was a constant fear before. So what can you tell us about what is occurring now?
Yeah, so myocarditis is a known side effect. Can happen with either of the vaccines. It appeared to happen a little more often with the Moderna one versus Pfizer, but it can happen with any of them. But the rate is 0.3, less than 1 per 100,000 people. So the rate is really low. Most of these people recover quickly, spontaneously, with just supportive therapy. But of the myocarditis cases, 93% of them did require, in this study anyway, 93% of the cases required hospitalization, and 23% of those required admission to the ICU. And just to remind people what the symptoms are, it's 1 to 3 weeks after the vaccine is given, chest pain, fever, headache, and shortness of breath. So without a obvious respiratory infection. And the one issue and follow-up here is that most of these people, 87%, as a matter of fact, had some abnormality on their cardiac MRI scan. That's a big scan they can do of the heart after recovery, raising the question that what are the long-term consequences? Now, we don't know if that's a permanent thing or it just takes longer for that to get better. We're not seeing yet any really long-term effects from it, but that this has to be watched very closely, even though it's a very, very rare event. So it's like 0.3 out of 100,000. So that's like 1 out of 300,000. Or it's like then if you do the math, it's like 4 out of 1,000,000 or whatever. It's really very few people getting this side effect, and most people recover. There's very few, if any, deaths are reported with this, and oftentimes the people that have the severe complications have underlying problems as well. So it's just something we have to be aware of and live with, because COVID does the same thing. If you get COVID, it's all sorts of problems, long COVID and COVID problems with the heart. So it's not just the vaccine, it's COVID itself too.
Yeah, absolutely. Well, going into our 2 viewer submitted questions, the first initial question says, I took the vaccine and booster and flu shot. Then I had COVID, took medication, Paxlovid, and got rebound COVID. The rebound felt just as bad or maybe marginally less bad. It remained in my head, so to speak, and so did not affect my lungs. Can I feel like I'm over it for a while? Do I have protection? Given my age and previous health problems, cancer and Crohn's, I really am pretty concerned about experiencing another round of COVID. Any suggestions? What should I ask my doctor, etc.?
Yeah, no, this is an unfortunate but very common story. So this sounds like it's an older person who has a couple chronic diseases, but is stable, and they're up to date with their boosters. They're up to date. They've had the flu shot, they've had the COVID booster, everything, and then they get COVID. Now, remember, the COVID vaccine doesn't prevent you from getting COVID. It only prevents you from getting severe disease, or lowers the risk. It doesn't prevent it 100%. So this person ended up just getting sick. They took Paxlovid. They're one of the rebound cases, like I had myself. And like Dr. Fauci and President Biden also had rebounds. It's really amazing. And this person got COVID again. But this person is, and people like this person are living today. They're not dying from this disease because this person didn't even go in the hospital, even though they have underlying medical problems and they're probably older. Because of the vaccine is saving these people. And the Paxlovid too is helping. So this is the way we're going to have to live with this disease. Stay vaccinated, keep your immunity up, take the treatment if you do get sick, and you'll survive. This person didn't even go in the hospital, even though they have 2 underlying conditions. So this is actually success as we know it today. Now that they've had COVID, they got even more immunity. You get immunity from the infection as well. So for the next couple months, this person is as safe as they can possibly be. That doesn't mean to go out and not wear a mask and go in crowded places, but it's a good sign. This person will do well over the next couple months at least. And then when the next booster comes out, the next recommendation, which will be sometime we'll hear probably mid 2023, then they should follow up with the next booster as recommended, because we're learning as we go how many of these boosters we really need. But this person has done exactly the right thing, and this person is doing well. Didn't end up in the hospital because of the preventive measures they took.
Yeah, absolutely. And now going into our second COVID question, Dr. Murphy. This individual is 58 years old, and they are currently being treated for, excuse my mispronunciation, Cultinos lupus erythematosus induced by the Pfizer vaccine. And they're wondering if you've ever seen a similar case via the Pfizer vaccine.
This is a very rare disease. And there is one case reported that we could find. And, it's the whole thing here is, Did the vaccine cause it, or did the vaccine uncover it? The same can be true about COVID, though. Did COVID lead to this, or COVID uncover? In this case, we're talking about the vaccine. So in this case, there's after this person took the vaccine, in the case that reported, and when they had the booster, it flared up a little bit again, but then it went down. So this person just needs to stay in touch with their doctor, their rheumatologist, probably, who's following them for this particular condition, and stay up to date with the boosters, because COVID can do even worse than the boosters. But this is not a blanket answer for this person, but they've got to work very closely with a professional that deals with this disease.
Wonderful. Well, thank you so much, Dr. Murphy, and we will see you next week.
Great. See you next week.